So they gave me a microphone in 3 minutes. So here we go. I am so honored and thankful and humbled to receive this award. And I just want to say that I wore this shirt today to remind myself of the battles that I don't have to fight every day. I'm white. I've never known what it was like to be pulled over because of the color of my skin, or to have a conversation with my young black son about living and staying alive. My family wasn't redlined when they moved to Atlanta in the 1930s to buy a house. I sleep in my own house every night. I have a car, and I obviously have enough food. I have a wife. We live in an out and proud relationship without fear of losing our jobs or our families. And I'm a doctor today because I was born to parents who didn't have a high school education, but who believed in education and who sacrificed to put me through college. I've cared for thousands of people living with and dying from HIV since the 1980s. I've been involved in research on over 40 drugs to treat and prevent HIV, but when I go home at night, I don't have to take HIV meds or even PrEP. So I wear this shirt to remind myself of the many privileges in my life that have put me on stage today, and because I was taught that to whom much is given, much is required. And so my job is to be an ally and to amplify the voices of the people who do not get awards, do not get the microphone, and do not even get breakfast. So ending the epidemic means challenging the status quo. And I have ruffled some feathers along the way from time to time, even in Fulton County government, even at the state, Dr. Toomey, even at CDC, Dr. McRae. But while ruffling feathers is not my goal, I've come to understand that challenging the status quo, in the words of my hero and Congressman John Lewis, sometimes requires necessary trouble, good trouble. So Atlanta is the country's most unequal city. We see that in our housing crisis. We see that in health disparities, not just HIV. At the state, we see Medicaid waivers that will be very expensive and will not expand health care to the people who need it most. And we continue to see dangerous bills that threaten the most vulnerable communities. And we also see that voter suppression is thriving in Georgia. And we can't tolerate this. In our nation, we see efforts to take away the civil rights of LGBTQ people, particularly the trans community, and to decrease access to health care for all people. And again, our voting rights are under attack. So I see advocacy as love, and our love is needed. Our voices are needed. And if we succumb to cynicism, we'll never end this epidemic. And we have a strong and resilient community. So on behalf of those not in this room and who are never at the table, it's up to us to be present. It's up to us to go to the meetings, to plan to end the epidemic. It's up to us to educate our officials, elected officials, and government officials who are working to make decisions. And it's up to us to go register voters and be sure that every single person votes. So I would say to you, my colleagues who don't need to hear this, we should never miss an opportunity to speak our truth and to spread our love. Thank you so much.